are continuing to fall. Today our total number of active cases is 3,359. The total number of recoveries is now over 28,327. There are 15 people in hospital with COVID. 8 are being treated specifically for COVID symptoms, and there is currently 1 person in the ICU. In terms of schools, all arrangements are in place for the return to school on Wednesday. All schools have their back-to-school packs and have begun distributing them last week, and will complete the distribution in over the next 2 days. Our schools are well prepared with systems and processes in place. Our learning spaces are well ventilated with outdoor learning areas being optimised. Importantly, there's no better place than school for a child's education or their well-being, and I would encourage parents to ensure that their children attend school this week. Pleasingly, the attendance numbers last week from those schools that returned were very high, well above 90% in most cases, so that's very pleasing. I do want to touch on Ms Courtney. Obviously we're aware that she has contracted COVID and has needed to fulfil border entry requirements to re-enter Australia. We now expect her back in Tasmania on Wednesday, and she'll officially recommence her duties this Thursday. Pleased to report that Ms Courtney is now fully recovered and has tested negative, as she needs to ensure that she can travel. The important point I want to make on this is that the arrangements for schools have been under construction now for a number of months. We've had an acting minister in place, and parents can have confidence that the plan has been developed and implemented, and that our schools are ready to go when their children return on Wednesday. I do want to touch on King Island just briefly. I want to announce today that the regular passenger flights that the government has been supporting between Hobart and the 2 Bass Strait Islands will be extended following the success of the Sharp Airlines service that were introduced in September of 2020. We committed $1 million at the time to underwrite these flights to support these island communities, and I'm very pleased that in terms of the patronage that we've had, that we've not had to utilise all of that underwriting commitment. In fact, it's allowed us to roll this forward. Importantly, we want to see this service be established for the longer term, and at this stage it looks very positive in terms of the demand for it. There's little doubt that both of these island communities and their economies have benefited greatly, and the current arrangement, which was due to finish in March, will now be extended until the end of 2022, and we'll continue to review it along the way. Importantly, in regards to King Island, which was hit hard as a result of that early outbreak that they had, we're aware that that island needs some further support. We're finalising a package to kickstart visitation on King Island, and later this week we'll be announcing the details of a new incentive program that is linked into the extension of the flights to ensure that we can boost further the King Island economy. And we've tasked Tourism Tasmania, they're working with King Island Tourism and the local council to deliver a new targeted marketing campaign to ensure that both Tasmanian and interstate visitors are encouraged to travel to King Island in coming months. We've always said that we will do more if more is required, and again this is another demonstration of that. Over the weekend, as you'd be aware, we announced further business impact support in terms of the extension of the program that we'd opened up from the 15th of January through to the middle of 15th of December through the middle of January, and we'll be opening a new support package which has been boosted in terms of the funding available, and that the period that we'll ask businesses to focus on is the 15 January to 14 February, and importantly we've increased the value of those grants and supports. But I have to say, having been in touch with a number of businesses, both large and small, it's very pleasing that we're seeing cautious optimism in terms of the way that customers are returning to businesses, and in fact for some businesses they are doing particularly well, but we recognise that not everybody is in that position, and obviously we want to do more to ensure that we can support them. I want to just touch on vaccination. A reminder to all Tasmanians that vaccination is our best line of defence. It works. Importantly, more than 44% of Tasmanians over the age of 18 have now had their booster, and if you are due, there are appointments available, and Catherine Morgan-Wicks will touch on that in a moment. Importantly, in terms of school, we've said continually add to your back to school list along with books and shoes, get a vaccination. For our 5 to 11s at the moment, the vaccination rate is 56.52%. Importantly, we're leading all of the states in terms of that, and I want to thank parents for coming forward and having their children vaccinated. But importantly, there are still appointments available, there are opportunities and walk-ins available, and if you want your child to have their first dose before they go back to school, there is every opportunity to do so before they walk back into school. But again, remember, it's the simple things that count. Make sure that we have good hand hygiene, continue to wash your hands, cover your coughs and sneezes. Importantly, keep a level of social distancing, and if you are unwell, don't go to work, don't go to a party, don't go to school, have a test and isolate until you get that result, and ensure that you do your bit to keep our community safe. I'll hand over to Dr. Scott now to take some questions, and then Catherine Morgan-Wicks will provide her update further on vaccination.
Thank you, Premier. I'm very happy to take any questions. Thank you.
What's the public health advice around students not needing to take twice weekly RAT tests or having surveillance testing, but rather just using them when they're symptomatic?
Yeah, sure. Look, I think it's a really important question. I think the whole discussion around the safety, COVID safety within schools and our advice around testing is really important for the community to understand. So, So public health has been working very closely with the Department of Health. I can understand that parents, carers and school communities are quite concerned about the risk, but it's very important that the public understand that there are very different levels of risk between people who are older and people who are younger around COVID in the community. So Public Health has been working very closely with the Department of Health in developing the COVID safety plan to get the right balance between ensuring children can continue their education face-to-face, which is very important for their long-term well-being, as well as balancing the risks of any outbreaks within schools to children and staff or the wider community. Our public health advice it underpins and it is included in every element of the plan. Our advice has been based on evidence that's been discussed at AHPPC nationally. We've also reviewed outbreak data around outbreaks interstate and expert opinions and experiences of trials of regular RAT testing undertaken by other states at the end of last year. We do know that young children and children are much less likely to experience severe disease and very unlikely to require hospitalisation. We've had very few children have required hospitalisation, with many thousands of cases involving children. It's a very low risk. So our advice within the plan around the COVID safety measures, including masks, wearing of masks, ventilation, COVID safety hygiene, the RAT recommendation for staff and students to test if symptomatic, the management of cases, contacts and outbreaks, all of our advice is in the plan. It's the best setting for our levels of transmission that we're observing in Tasmania. Other states are putting in place other testing regimes. They have much higher levels of transmission. We've been very lucky to date to have lower levels of transmission, and our advice around RAT testing for students and staff is also consistent with our broader recommendation for the Tasmanian public and different workforces, including healthcare workers and residential aged care workers. We're not recommending that those workers at the moment undertake regular testing, and there's no regular testing of patients in hospitals unless they have symptoms. So we believe our advice, and our advice is there in detail in the plan, is the best balance for Tasmania to get the best educational outcomes and the best health outcomes for children in schools.
If we know though that COVID isn't as serious for young children, many of them may be asymptomatic if they have COVID. If so, wouldn't it still be best to conduct those regular rat tests in case it's not obvious if children actually have COVID when they attend school?
Because we know that children are at a much lower risk of infection, the consequences of infection, and we know that they're much less likely to transmit as well. People who are symptomatic without coughing and sneezing and runny noses are much less likely to transmit COVID than a person with symptoms, but we do consider a person can be infectious before they develop symptoms. Our advice to get that best balance, to make sure that children who are at a very low risk of serious outcomes but get the best educational outcomes, is for that testing to occur on the basis of symptoms. It's the same for students, it's the same for parents, it's the same for our advice for all people in Tasmania in different service areas and different workforces. And we believe that will, to date, it's served us well, and it will help us get the best outcomes in schools.
Do you know how many COVID cases have been detected in Tasmanian schools that have returned, and has there been any cases of transmission within those schools?
So public health, we are aware that there are some schools that returned last week. There will be further schools, both independent and all public schools will return this week. Part of our outbreak guideline and work that we've done with the Department of Education and the independent school sectors has involved developing a guideline that sets out very clearly what the roles of the school is and what the roles of public health is in the situation of a single case or when we reach the threshold of an outbreak. Public health, we will be informed of every outbreak that occurs, and to date with the schools that have opened, we haven't been informed of any outbreaks at all. There are children that are diagnosed with COVID every day within these age groups, but we certainly have no evidence of current outbreaks in schools. And most of those children that have been notified will have acquired their infection from within households or within other settings within Tasmania.
Can you tell us though how many students actually have contracted COVID though since school return? Do you have that data available?
No, the schools collate that information and manage small numbers of cases. Our arrangements with schools are that we will support schools once they get to that outbreak level, which we have defined as 5 cases within a learning group within 7 days, either within staff or students. Now that definition of a learning group will differ depending upon whether it's an early childhood education and care setting, a primary school, a secondary school or a college. But our role is we've provided advice and support for schools to manage a very small number of cases, and they can do that very well, and we ask to be informed once we have identified an outbreak, and that requires further
sort of tests people should get?
We've certainly always encouraged either a RAT or PCR for people who have symptoms. Most people are certainly undertaking RAT testing. About somewhere between 2/3 and 3/4 of all of our cases each day notified are on the basis of RAT testing. But the other third to a quarter does involve people undertaking PCR testing because we have symptoms and we have good capacity for that testing. So our recommendation is certainly that people undertake a test, a rapid antigen test, which can be very convenient, or they can certainly organise a PCR test if they have symptoms.
Do you have any concerns? I mean, South Australia is obviously thinking that PCR is the better way to go if you've got symptoms. Do you have any concerns about, you hear plenty of people returning plenty of negative rats when they're symptomatic and then doing a PCR and it's positive? Do you have any concerns around the, heavy use of rats over PCRs?
No, we don't have any concerns. Each state will make its decisions around its best settings for its testing, its TTIQ, or its testing, the tracing, isolation and quarantine arrangements. South Australia is making their decision based on their level of community transmission and the impacts that it's having on their communities in different settings. And Tasmania will make the best decision for our settings and our community as well. And we think that Tasmanians can certainly have confidence in using RAT testing for the usage that we've recommended, the purposes that they be used for someone who's symptomatic or someone for testing as a close contact on day 1 or day 6 of their quarantine period.
Dr. Veach has previously said that Tasmanians should expect a spike in COVID cases once schools return. Do you have any modelling yet to suggest how many cases we can expect to pop up in schools and then the broader public?
Look, I think we can expect to see further cases. We know that there have been tens of thousands of rapid antigen test kits that have been distributed to private schools, and this week, over 100,000 kits, I understand, will be distributed across public schools. There'll be a lot of testing that's occurring in the community, and I expect that we will see that there'll be an increase in the number of cases that are diagnosed in school-aged children. That's good to pick those cases up. They'll be managed appropriately. We ask parents, if they return a positive RAT test, that you must notify public health by registering that result on the website. I think we can expect to see further cases, and I think the community, public health will continue to monitor the levels of transmission in the community and respond appropriately. So I think we should prepare ourselves for an increase in the number of cases. It doesn't mean that it's having a serious impact on our healthcare system. We'll monitor hospitalisations and ICU admissions as well, and we'll certainly continue to monitor outbreaks in critical settings and work with those settings. So we can expect further cases, and we'll monitor the impacts on the wider community and in schools.
Thank you, Dr. McEwen, and good morning, everyone. Today I'll provide an update on vaccination, testing and hospitals. For vaccination, as of Saturday the 5th of February, close to 99% of Tasmanians over the age of 12 have had at least one dose of the vaccine, and over 95.6% are fully vaccinated. 45.3% of people aged 18 and above have had a booster dose of the vaccine, and now, including teenagers, 44% of 16 plus have had the booster. And 56.5% of children aged 5 to 11 have had a first dose of the vaccine. So if I can talk about our 5 to 11s, we have made a fantastic start in vaccinating children aged 5 to 11, and I want to thank all of the 25,500 children and their parents who have come forward for their first dose of vaccine before they go back to school. As schools go back, I'm pleased to report that we have the second highest vaccination rate for this age group of any state or territory, and we are nearly 12% higher than the national average. But we have just under 20,000 5 to 11-year-olds still without a first dose, many that are booked in, but many that I encourage to come forward and get that first dose of vaccination. So as we know, as children go back to the classroom, vaccination will help reduce transmission between students and reduce the likelihood of bringing the virus home. However, we obviously want to go a lot higher and match our high levels of vaccination across our other age groups. There's still time for children to get that first dose of vaccine, with clinics today in Glenorchy and Launceston's Door of Hope Church, and we also have 60 GPs that are also offering children's vaccination across the state. We will continue to offer specialist children's clinics going forward, with clinics running in Burnie, Devonport, Launceston and Hobart next weekend and in coming weeks. And don't forget your 12 to 15-year-old children. We have slowly increased up to 86% of 12 to 15s receiving a first dose of vaccine, but we still have just under 6,000 12 to 15s still to receive a first dose. If I can go to boosters, last week ATAGI approved the Pfizer vaccine as a booster for teenagers aged 16 and 17, and this change has taken immediate effect, with around 12,000 Tasmanians aged 16 to 17 eligible for a booster. It also means that all Tasmanians aged 16 and over can now get a booster 3 months after their second dose. 16 and 17-year-olds who are eligible must get the Pfizer vaccine for their booster, as Moderna is currently only approved as a booster for people aged 18 plus. If you are 16 and have had your second dose before 7 November, you are now due and can make a booking at a state clinic, at participating GPs or at a participating community pharmacy. And I want to encourage all Tasmanians to please check when they had their second dose of the vaccine and when the 3-month milestone arrives to please book in. The date of your second dose is your valid from date on your COVID-19 immunisation certificate. Thousands of appointments are available at state-run clinics over the coming weeks, and you can book by going online or calling the public health hotline. This week we have plenty of appointments available across the north and northwest at Burnie Arts and Function Centre today and tomorrow, at Devonport's Don Centre tomorrow, and Launceston Old Transit Centre Tuesday through to Saturday this week. There are also more than 100 pharmacies and 100 GPs offering first, second or booster doses across Tasmania. On testing, I'd like to start by thanking everyone that got tested yesterday. In total, 1,105 PCR tests were processed through our labs and 1,035 RATs were distributed across the state, with 355 that were sent to rural and regional addresses. As schools go back, we will have over 300,000 rapid antigen tests in circulation, with 48,155 distributed to Catholic schools, 35,549 to independent schools, and over 230,000 distributed to public schools. And we have also distributed 10,400 rapid antigen tests to early childhood and childcare facilities. So our rapid antigen test registration process is continuing to run smoothly, and we're issuing several thousand RATs a day to close contacts and symptomatic people via our click and collect or through our courier service. And as a reminder, and noting the questions on PCR testing, which continues to be available for people that are unable to access or perhaps are uncomfortable using a rapid antigen test. Same-day appointments are available for our PCR testing, and the turnaround time in our state clinics is under 24 hours for your result to come through. To finish on hospitals, last week all 4 of our public hospitals de-escalated to pandemic response level 2, with outpatient activities recommencing in a staged approach. And Tasmania's incredibly high vaccination rates have meant that we continue to experience low rates of COVID hospitalisation and ICU care in Tasmania, which has allowed us to continue the provision of crucial health services, including Category 1 elective surgery during this period. And I note that in many mainland states that this has not been the case, with elective surgery ceased and dates being announced for resumption later this month. But I am pleased to report that we will be increasing our rates of elective surgery this week, but we'll be closely watching the staffing impacts from COVID as schools resume. In our public hospitals, as the Premier noted, we have 15 COVID positive inpatients, with 8 being treated specifically for COVID. And this includes 14 in the south, 1 in the northwest, and 0 patients in the north. And there is 1 patient receiving ICU level care in the south and is being ventilated. And as at Friday, we had 50 healthcare workers who were COVID positive, 64 reporting as close contacts, and to date we have a total of 510 close contact exemptions that have been granted for healthcare workers.
I was just going to ask about City Hall, because I thought that was going to be used under the escalation plan, and has that plan changed now that the hospitals have been taken down to level 2?
So we continue in terms of our City Hall preparations, so that has always been there as our contingency. We announced a few weeks ago that we would start those preparations, and that was when we were noticing an increase in our hospitalisation level, and I think I mentioned a patient level of around 30, for example, in the south. That meant we would either have to open up another COVID ward at the Royal, or just to treat these, outpatient COVID patients coming in for day treatments, so not for overnight. So our City Hall remains as a contingency.
Now that the hospitals have de-escalated, what sort of volume of elective surgeries are we doing now compared to what we might have been doing pre-COVID?
So in terms of the actual timing of the COVID cases, as they've occurred over a Christmas and New Year's period, that is actually our traditional downtime in terms of non-urgent elective surgery. So that currently operates from around the 20th of December and can run up to about the 12th of January. So it has coincided with that peak in COVID cases, which has meant that we've been able to, we continue always, the emergency surgery, which continues 24 hours a day, 7 days a week, and often our urgent Category 1 elective surgery cases always continue through that period. But as staff have come back on from holidays, we are continuing. Now we're picking up this week our Category 2 and 3 elective surgery. So I think the critical point for Tasmania is that we haven't stopped elective surgery. At each escalation point as we move the hospitals up, we review on a daily basis according to how staff have been impacted by COVID. If we don't have absenteeism, for example, in our surgical teams, we continue to do surgery. So we're really looking at the impacts, who has COVID, who are close contacts that are not available, so that we can safely do those services in our hospitals.
Been made about the future of the CheckinTarazan app?
Not as yet. Now, it's under review. I'd expect that we'll have something to say post the 15th of this current month.
And have any teachers been asked to come back to school and cancel their long service leave to manage staffing arrangements in schools?
Oh, look, I don't have any detail on that. We've said, in terms of the relief teachers, obviously we have around 1,700 that are on the list. And then in terms of retired teachers, we indicated that we'd be reaching out to them as well. But I think the Secretary of Education this morning indicated that he was comfortable with the pool of the 1,700 relief teachers. So in terms of the detail of your question, I don't have any answers on that.
And with schools all schools due to return by Wednesday, do you have any indication yet of how many of those 400 retired teachers have actually committed to coming back to teaching?
Oh, look, I don't have that detail at the moment. Again, the point that I'd make is that in terms of the first order, should we need to utilise additional teachers, it would be the relief pool that we would utilise. But in terms of that work that the Education Department was undertaking, I can get you some detail on that if that's available.
There are some concerns from educators that there aren't enough air purifiers being allocated to schools. How many devices are being given to each school, do you know?
My understanding is that in terms of air purifiers, that we have around 4,500 air purifiers that will be available in schools. And I understand from the Secretary of Education as well that around 400 CO2 monitors, so more than enough to cover the suite of schools that we've got. So look, I haven't heard those concerns. And again, as Public Health have made perfectly clear, the first priority is to ensure that we have good ventilation. We've worked through in terms of windows. I understand that there's around 90% of all classrooms have been attended to. And I did make the point last week in terms of windows. We've all been in a classroom. Many classrooms have 19 or 20 windows, and it may be one that just needs attention. We're obviously started with those classrooms that need more attention than others. So, but at this stage, in terms of concerns regarding air purifiers, I haven't heard those, no.
Are you happy with how the emergency COVID cases on a cruise ship has been handled here? Absolutely.
Look, again, that's a textbook public health response. In terms of, I think it's the Coral Explorer? Discoverer. That is in line with their COVID safety plan and is managed very appropriately by public health.
Just one on the Black Tuesday bushfires. How important is it to remember that occasion affected so many people?
Well, look, you're right. It did affect an incredible number of people at that time. More than 60 lives were lost. I think from memory, more than 900 people were injured, I think, at that particular time. That was a very, very difficult and tragic period, and especially that day for Tasmania. And so I think it's important. I think if there is a message for Tasmanians, it's make certain that you have a bushfire plan and that you have reviewed it and that you understand what you would do. In terms of our dislocated communities that we have, it's so important in Tasmania that you ensure that you are ready should fire as a threat arrive at your door.
And I understand people are being told not to eat kingfish from the Mersey River following that oil spill. What's the government doing to minimise the impacts of that oil spill?
Well, the EPA is obviously working as quickly as it can in concert with TasPorts. To ensure that oil spill can be cleaned up as quickly as possible. But the advice very clearly is on the basis that there is an oil spill in the river, that you shouldn't eat fish from that river until the EPA have provided clearance.
Thanks all.